Hi ASP students, it's Mark again with some more movement analysis video information for you. Looking at the hip joint this afternoon, as you can see I've got a female sprinter coming out of the blocks, a perfect example of the motion of both hip joints. Students often find the hip joint the most tricky one to learn. I'm hopefully going to be able to give you a couple of tips and hints on how to make this easier. Just before I start, another typical action that has been assessed in ASP exams, if I just draw a stick man here for you, is a gymnast on the Olympic rings. So they're holding Olympic rings and their legs are out in front of them, and obviously the hip joint is here. So they're holding onto the Olympic ring there with the red dot. That's my best art for you there. So that's the other sort of example we've seen in recent years on the hip joint. Okay, right, so back to the female sprinter. She's obviously coming out of the blocks and we need to name the joint type. Now, there's a lot of movement available around your hip which tends to give it away. Students tend to know that there's a lot of movement around the shoulder joint as well, and it's where the joint fits nicely into a socket. So it's called a ball and socket type of joint. Okay, so the hip, like the shoulder, is a ball and socket. It's the femur that fits into the pelvis. So that's the ball is the head of the femur, and the pelvis is the socket. Okay, then we have to look at the type of movement occurring at the hip joint. Now, the exam question will tell you which leg to look at. If it says the left leg, you've got to think, right, which one is it on the sprinter? So left leg on the sprinter, I'm now going to put with blue. So the left leg on the sprinter is this one. So we are talking about the movement of the hip joint on the left leg. Okay, you must get that wrong. It would be totally incorrect to go for the other leg, as they are different movement patterns. So, on this blue leg, we have extension. And that's there on the screen for you. On the front leg, drawn with green, I always tell students to try and use a little bit of a trick method when learning with the hip. Is the leg in front of you or behind of you? And because it's in front here, try and remember front equals flexion. So try and use that as a bit of a cheat method on the hip. It does work, as you can see here as well. If I draw on green here, this whole limb is in front of the performer, so the hip is flexed. Where I'm drawing green now, the hip is flexed. Now, muscle groups, tough. You've just got to learn these again. Flexion is the iliopsoas. I've seen some strange spellings of this. Remember, spelling 100% accurately isn't necessary, but it must very closely resemble that word. But obviously, we want you to learn it to the best of your ability. So front flexion, the iliopsoas, is the muscle group, okay, causing flexion. So if we're looking at this front leg, the other limb is going through extension. And for that, you have your powerful hip extensors, the gluteus maximus. Okay? So those are the key questions that you could perhaps have to label on a hip joint movement analysis. There are several other points that I'll look at when we look at and consider the knee joint as well. Okay.